Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us again. This morning, Dr. Stuart Hershman has taken the time to talk with us. He's an orthopedic spine surgeon at Massachusetts General Hospital in Boston, and he's joining us to talk about his presentation from the American Academy of Orthopaedic Surgeons 2020, entitled, Is It the Back or Hip? Welcome to the program, Dr. Hershman.
Thank you. Pleasure to be here.
Well, I thank you for taking the time to join us here. As an orthopedic spine surgeon at Mass General, talk a little bit about what it is that you do and some of the patients that you deal with.
Well, we see a whole spectrum of patients from some of the more simple spinal pathologies like disc herniations and lumbar stenosis to many of the more complex pathologies like spinal deformity and tumors. And we treat all of those pathologies from sort of stem to stern. So we treat all the conditions that occur from the base of the skull, from the occiput, all the way down to the sacrum.
Now, is the hip part of the back? Is any part of the hip part of the back?
No, it's not. Actually, there's a whole section of I'll say two whole sections within orthopedic surgery that address hip issues specifically. One of those being adult reconstruction, where they treat osteoarthritis of the hip, and then some of the sports guys will treat hip pathologies that are due to labral pathologies and a host of other different pathologies, and they'll do that using hip scopes and arthroscopy techniques. So no, the spine is not at all connected to the back, and I don't treat any hip pathology.
So when someone presents with pain, how do you know if it's the hip or if it's something in the spine that's causing the pain in the hip?
Well, I think that's a great question, and that's actually the reason that we went out and put out this instructional course lecture at the Academy. You know, sometimes diagnosing the actual pathology that's causing the patient's symptoms is a little bit trickier than we would like it to be. And one of those times is when patients present with hip pathology and lumbar spine pathology and have either both or one or the other hip or back pain, because both pathologies can be contributing to those symptoms. And so trying to tease out what the true pain generator is can be very tricky, very difficult.
When it comes to the nerve endings in the spine, I mean, it controls every aspect of our body. How complicated is it to do the due diligence to precisely pinpoint a person's problem and then deal with it effectively? Sure.
So, you're absolutely right in that all of our nerves emanate from sort of a central source. And you can absolutely say that the nerves, as they come off the spine, will go to other parts of the body, and that's really why they're causing pain. And that's one of the things that we see typically in patients with lumbar spine pathology. We'll see a nerve root that's either squeezed or compressed, and those nerve roots will be sending off pain in other parts of the body. We would call that referred pain. So, for example, the classic example is what people refer to as sciatica. They'll have pain that runs down the leg, but it's actually coming from a problem that's at the lumbar spine. One of the issues is that as those nerves go off the spine, they send off little branches to various parts of the body as they pass. And one of the places that they pass very soon after leaving the spine is the hip. And so you can see a lot of patients who present with hip pain or buttock pain that is actually emanating from the spine. Conversely, you can have a lot of patients who have hip arthritis and a whole host of other hip pathologies, which can be irritating nerves and present as if it's a back issue. And so it's not that the pain is being referred back up to the spine, but it certainly is causing a low back pain issue, or that's what's perceived by the patient, and it's a result of the hip. And so really trying to figure out what the source is can be quite challenging.
How often do you find that what you thought might be a surgical procedure turns out to not necessarily be something that requires surgery, but maybe a little physical therapy having to do with the back or the hip?
Sure. So I'll say that fortunately for most people, most spinal pathologies can be treated non-operatively. Almost all spinal pathology can be treated non-operatively. It's only sort of the worst ones that fail non-operative treatment. Those are the ones that we generally recommend surgery for. That's from the spine perspective. From the hip perspective, diagnosing hip arthritis, radiographically is actually very easy, but making certain that that's the only source of pain can be a little bit more challenging. And so, I'll say, to answer your question, very rarely do we sort of get fooled by a patient and take them to the operating room. I hate to say unnecessarily, but too soon, so to speak. I would say that more often than not, surgeons do an excellent job at teasing out the pain generators and really doing their due diligence to find out what's truly causing the pain. And so that means putting patients through a whole gamut, not just of non-operative treatment, but also of some diagnostic tests to make sure that we're really sort of dotting all the I's and crossing all of our T's.
How much more complex is it to properly identify pathology, whether spine or hip, in the geriatric patient?
It becomes a little bit more challenging only because typically those patients will frequently have both, or radiographically will have degenerative changes in both locations of the body. And so it's very easy if somebody has hip pain, for example, or low back pain, and their only pathology is in the hip, or vice versa. If they have low back pain radiating into the leg and they have no hip arthritis and no radiographic findings of the hip, then you can easily say, oh, this is coming from the hip or this is coming from the spine. It's the patients who have both degenerative changes in both locations that can make it a little bit more challenging. And frequently we see that much more often in the geriatric population than in a younger population.
Is arthritis as prevalent in the spine proper as it is in many of the other joints that we so frequently hear about when it comes to arthritis?
Absolutely. It's for whatever reason, patients don't realize that the spine is just a series of joints like any other part of the body. And if you're walking on 2 feet and you're upright against gravity, you will get arthritis of the spine. You will get lumbar stenosis. It's just a matter of time. Some of us get it at age 30, others get it at age 130, but we'll all get it eventually.
What would you say is the biggest takeaway from this information that you presented this year?
I think that it's very easy sometimes to see things through our tunnel visioned worlds. And so for spine surgeons, we very quickly will look to the spine when patients present with lower extremity pain. And for hip surgeons, I think that it's very common for them to look to the hip when patients present with groin or buttock pain. And if we kind of step out of our worlds for a moment and remember that there are other areas of the body that can also cause these symptoms, we're doing a very good service for our patients to recognize that, work that up, and make sure that we're treating the true pain generator before we take our patients to the operating room.
Is there a place online that our listeners can go and get some more information and possibly peruse this presentation as well? Well,
I would say that the information online about hip spine syndrome is a little bit lacking, and that's part of the reason that we decided to put together this ICL was to sort of make this a little bit more understood and a little bit sort of raise awareness, if you will. There are some great articles out there recently through the American Academy of Orthopaedic Surgeons and the Journal of the American Academy of Orthopaedic Surgeons. There have been a couple of good articles on hip spine syndrome and also the various pathologies that contribute to both lumbar and hip pain. And so I would advise our listeners to seek out those articles if they're interested in learning more about these pathologies.
Dr. Hershman, it's been a pleasure speaking with you this morning. Thanks so much.
Thank you. Have a good day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.